Dementia is a progressive condition that affects an individual's cognitive abilities, including memory, reasoning, language, and problem-solving skills. As the disease progresses, it can also lead to changes in behavior and personality. These behavioral changes can be challenging for caregivers and family members to manage. In this comprehensive guide, we will explore various dementia-related behaviours and provide practical strategies for managing them effectively. Before delving into specific behaviours and management techniques, it is essential to understand the underlying causes of these behavioural changes. Dementia can affect the brain in ways that alter an individual's perception, emotions, and ability to communicate effectively. Additionally, environmental factors, unmet needs, and physical discomforts can contribute to these behaviours. 1. Agitation and aggression. Individuals with dementia may exhibit agitated or aggressive behaviours, such as shouting, hitting, or resisting care. These behaviours can be triggered by various factors, including confusion, fear, pain, or environmental overstimulation. 2. Wandering. Wandering is a common behaviour in individuals with dementia, where they may attempt to leave their surroundings or wander aimlessly. This behaviour can be dangerous and pose risks of getting lost or injured. 3. Sundowning. Sundowning refers to an increase in confusion, restlessness, or agitation that typically occurs in the late afternoon or evening hours. This behaviour is believed to be related to fatigue, changes in the environment, or disruptions in the body's internal clock. Number 4. Repetitive behaviours. Individuals with dementia may engage in repetitive behaviours, such as asking the same questions repeatedly, pacing, or rearranging objects. These behaviours can be a coping mechanism or a result of memory impairment. 5. Apathy and withdrawal. As dementia progresses, individuals may become increasingly apathetic, withdrawn, or lose interest in activities they once enjoyed. This behaviour can be a manifestation of depression or a result of cognitive impairment. 6. Sleep disturbances. Sleep patterns can be disrupted in individuals with dementia, leading to insomnia, excessive daytime sleeping, or a reversal of the sleep-wake cycle. 7. Hallucinations and delusions. In some cases, individuals with dementia may experience hallucinations, seeing, hearing, or feeling things that are not real, or delusions, firmly held beliefs that are not based in reality. While managing dementia-related behaviours can be challenging, there are several strategies that caregivers and family members can employ to promote a more positive and supportive environment. 1. Create a calm and predictable environment. A calm and predictable environment can help reduce agitation and confusion in individuals with dementia. This can be achieved by establishing routines and structures for daily activities, minimizing noise, clutter, and overstimulation, using gentle lighting and soothing music, providing clear visual cues and simple instructions. Example: Martha, a caregiver for her mother with dementia, noticed that her mother became agitated during evening hours. To create a calming environment, Martha established a consistent bedtime routine that included a warm bath, gentle music, and a calming bedtime story. This routine helped her mother feel more relaxed and prepared for sleep. Number 2, identify and address unmet needs. Behavioral changes in individuals with dementia can often be a means of communicating unmet needs, such as hunger, thirst, pain, or discomfort. By identifying and addressing these needs, caregivers can help reduce or eliminate the problematic behaviours. Example: John noticed that his wife, who has dementia, would often become agitated and resistant during mealtimes. After observing her closely, he realised that she was struggling to feed herself due to her diminished motor skills. To address this need, John started providing her with adaptive utensils and assistance during meals, which significantly reduced her agitation. 3. Use effective communication strategies. Effective communication is crucial when interacting with individuals with dementia. Caregivers can employ the following strategies: speak slowly and clearly, using simple language, ask one question at a time and allow time for a response, use gentle touch, eye contact, and a calm tone of voice, avoid criticizing or arguing, validate their feelings, and provide reassurance. Example: when Susan's father, who has dementia, became upset and started accusing her of stealing his belongings, she remained calm and acknowledged his feelings. Instead of arguing, she gently reassured him and redirected his attention to a pleasant activity, effectively diffusing the situation. Number 4. Encourage physical activity and engagement. Regular physical activity and engagement in meaningful activities can help reduce restlessness, agitation, and boredom in individuals with dementia. Caregivers can provide opportunities for light exercise, such as walking or stretching, engage them in simple tasks or hobbies they previously enjoyed, offer sensory stimulation through music, art, or tactile activities, encourage socialization and participation in group activities. Example: Tom's wife, who has dementia, often became restless and agitated in the afternoons. To address this, Tom started taking her for short walks around the neighborhood, which helped provide physical activity and a change of scenery. Additionally, he introduced simple crafts and gardening activities that she enjoyed, which helped keep her engaged and reduced her agitation. 5. Use redirection and distraction techniques. When an individual with dementia exhibits problematic behaviors, caregivers can use redirection and distraction techniques to shift their focus and diffuse the situation. This can include gently redirecting their attention to a different activity or topic, introducing a familiar object, sound, or smell that has a calming effect, engaging them in a simple task or activity they enjoy, using humor or reminiscing about pleasant memories. Example: when Anna's grandmother started becoming agitated and wandering during the evenings, Anna learned to gently redirect her attention by introducing a favorite puzzle or engaging her in a simple baking activity. This not only distracted her from the wandering behavior, but also provided a sense of purpose and familiarity. 6. Consider medication and professional support. In some cases, dementia-related behaviors may be severe or persistent, and caregivers may need to seek professional support. This can include consulting with a healthcare provider about potential medical causes or medication adjustments, seeking support from a cognitive behavioral therapist or dementia specialist, exploring non-pharmacological interventions such as aromatherapy or music therapy, joining a caregiver support group for additional resources and coping strategies. Example: when John's father's aggressive behaviors became increasingly difficult to manage, they consulted with his healthcare provider. After ruling out potential medical causes, the provider recommended a low-dose antipsychotic medication to help manage the aggression. Additionally, they sought the guidance of a dementia specialist who provided coping strategies and environmental modifications to further support John's father's needs. Managing dementia-related behaviors requires patience, empathy, and a tailored approach. By creating a supportive environment, addressing unmet needs, communicating effectively, and employing various management strategies, caregivers can better understand and respond to the challenges of dementia. Remember, seeking professional support and connecting with caregiver resources can provide invaluable assistance and guidance throughout this journey.